your baby actually latched on. How do you know if they have a good latch? I'm Erin. I'm a pediatric nurse practitioner and lactation counselor, here to serve you up bite-sized pieces of feeding information so you can feel calm and good feeding your baby. A good latch isn't just about how it feels. Sometimes your baby has a bad latch, you have nipple pain, and you're like, oh my gosh, something has to change. But sometimes it's the opposite. Sometimes your baby doesn't have a great latch, but it really doesn't hurt you. What I want to do is teach you how to not go off just how it feels, but actually know what to look for with a good latch. Because here's the problem. If your baby has a poor latch, sometimes they don't remove milk effectively. This leaves milk in the breast, and then it tells your body to make less milk. And that's literally what no mom wants. If your baby is latched and maybe it doesn't look perfect, but you're comfortable, your baby is gaining weight, great, your breasts feel less full after a feed, I'm very reluctant to make any changes. If it is working, keep going. What I want to talk about is when it's kind of not working. Either your baby's not gaining weight, you're feeling like your baby's not removing all the milk in your breast, or you're feeling like, oh my gosh, I am in so much pain. The first thing we're going to do to see if your baby has a deep latch is look at the corner of their mouth and look at their cheek. If your baby has a deep latch, the corner of their mouth should almost look like a straight line. So it's like a 140-degree angle, almost to a straight line, but not quite there. If your baby's corner of their mouth is looking very narrow and not wide open, that's probably a sign that their latch is not very deep. The other thing that we want to look at is the shape of their cheek. If a baby has a shallow latch, their cheek often dimples in. And it's not like they're natural, sweet little dimples. This is when they're sucking in, they're using so much pressure, their little cheek dimples in. If they have a nice deep latch, they're going to have a rounded cheek almost the entire time that they're feeding. I'm often asked if a baby needs to have flanged lips to have a good latch. I find in practice that a lot of babies don't flange their lips naturally. Sometimes you have to just pull out their little upper lip and pull out their little bottom lip. The bottom lip is a little bit harder. You have to sort of flange it out for them on the nipple. The next thing I want you to do is look at your breast. What we're hoping is that baby is on the areola, the dark part around the nipple, and not just on the tip of the nipple. That's going to create some pressure damage and can leave milk in the breast. If you're looking for help with latching, I will link a video to help you get a good deep latch. But what we're hoping is that baby is on the areola and it looks a bit asymmetric. You'll see a little bit of the areola on top and they have more of this like bottom tissue, but it's a little bit asymmetric. Going back to the last video of what does it actually sound like when your baby is sucking and swallowing, oftentimes when they're latched really well, you can hear this good rhythmic pattern of how they're sucking and how they're swallowing. Then I want you to assess, how do your breasts actually feel after a feed? We are looking at the baby's mouth, we're looking at the baby's cheek, we're looking at how baby is latched on your breast, but then I always like to assess, how does the breast feel after a feed? If your baby is actively and effectively removing milk, your breasts are going to go from feeling full to lighter. They might not be as taut depending on how early you are, and if you're engorged, they'll feel less full, a little bit lighter after a feed. Now, if you're feeling like your baby is leaving a lot of milk in the breast, or you're still feeling very, very full, I would want to assess a little bit more. Is it because you have a lot of milk capacity and you have a lot of milk production and they're not removing milk because they're full? Or is it because they're not actually effectively removing milk? If you ever are questioning your baby's latch or if your baby is effectively removing milk, I often recommend just seeing a lactation professional. So whether you see me and we do a virtual visit, or if you see a lactation professional in person, they can help you with all the maneuvering of your baby's body and positioning to help you get as deep of latch as possible. Now, what I want to talk about is what happens when your baby maybe doesn't have the most optimal looking latch, but you're comfortable and your baby is gaining weight. They're having enough wet and poopy diapers and really everything is great. You can push your areola very, very gently into the corners of their mouth. So you're literally just pushing them in, but while you're doing that, you're using this hand, that's like the head support hand. So if you're shaping your breast, you're kind of pushing your areola in with your thumb and pulling baby closer to you. So you're giving them a little bit more stabilization and pushing in a little bit more areola. It may work, It may not, but it's the only way that I know of to get your baby to latch a little bit deeper when they're already latched. Now, if your baby is latched, it is a shallow latch and you're having discomfort and pain, what I recommend is trying to relatch. So redoing all the things, making sure your baby's in the right position and then latching again. To do that, if your baby is already latched on and they're sucking on the nipple and they're really tight on there, you put your finger into the corner of their mouth and then rub your finger along their gum line. This will help break the seal and then they'll kind of pop and then you can try to latch them again. Hopefully this video helps you feel more confident knowing that your baby has a good latch and what to do if your baby doesn't have as great of a latch. My goal is to help you feel more calm and confident breastfeeding your baby. And if breastfeeding feels hard, it's because a lot of times it is hard, but it does get easier. If you have any questions, don't hesitate to reach out. Make sure to hit subscribe. Bye-bye.